Okay, hey everybody. So in this short video, we're going to talk about some of the effects of activating the noradrenergic system. So in the previous video, I talked about how the system is huge and diverse, and that makes sense. Just look at that picture on the screen. Look at that, the sagittal section showing you the projections of the noradrenergic system throughout the brain. Obviously, you know already that the locus coeruleus makes that neurotransmitter, projects it everywhere. And then don't forget that norepinephrine is also, it acts like a hormone in the periphery. So there's a number of peripheral nervous system effects as well. We're going to focus on the brain, but in a minute, we're going to talk about a few different things that are important to just at least consider the peripheral nervous system. So in this video, we're just going to focus broadly on arousal, cognition, and memory consolidation. Okay. So arousal, like wakefulness, right? If you're awake during the day, you're feeling aroused, right? So arousal as opposed to like periods of sleepiness or actual sleep, like slow wave sleep and REM sleep. If you don't know what those are two different stages of sleep. Slow wave sleep has really big synchronous waveforms, like electroencephalogram waveforms. REM sleep has really slow and desynchronized waveforms, sorry, really fast, low amplitude. Okay, so one thing we know is that locus coeruleus neurons fire more often during wakefulness. So during daytime hours, when you're up and doing something, your locus coeruleus neurons are firing more action potentials than when you are sleeping. And now on this graph here, what you're looking at is a couple of different noradrenergic agonists that were infused into a part of the brain called the medial septum. And what you're measuring is time awake after that infusion of drugs. So that orange bar, that's the vehicle, so that's saline, so that's nothing biologically active should be happening inside the brain. And that's the amount of time that animal spent awake during this period that they were measuring it. Let's see, the blue bar is a low dose of fen, that's an alpha-1 agonist. The red bar is a low dose of iso, that's a beta-1 agonist. And then the purple bar is fen and iso together, so beta-1 plus alpha-1 agonist. And you can see that the combination of those activating of those two receptor systems had the biggest amount of time that the animal was spent awake. Okay, and that makes sense. So you activate the noradrenergic system, the animal's going to be awake more often. Every time. All right, there we go. One day I'll get it. I just need to start advancing the slide like 5 minutes before I'm actually ready to. Okay, so norepinephrine is also really important for attention and learning and memory. So first I just want to draw a quick distinction between working memory and long-term memory. You probably have had this in intro psych, but just in case you forget, your working memory is sort of like, it's similar to short-term memory, not exact, but we're not going to really differentiate hugely in this class. But it's like what you're thinking of when you're thinking of something. If I asked you to memorize a phone number, for example, and you just repeat those digits in your head, that would be an example of working memory. You're not going to really need to remember that phone number, you know, in 3 weeks. So if I ask you to memorize some digits and then ask you again in 3 weeks, it's probably gone. But if I'm asking you to remember, well, I don't know what the receptors are for the noradrenergic system, it's in your working memory at first. And in theory, it's getting consolidated into long-term memory so that when I quiz you on it, you will know the answer. Okay. That process of consolidating working or short-term memory to long-term memory is a really biologically important process. We will talk about it a little bit down the road, but not a lot. But there's a lot of things that happen intracellularly at the molecular level to convert a short-term memory to a long-term memory. Okay. Some of that depends on norepinephrine, which we'll talk about in a second, and epinephrine as well. Okay, so alpha-2 receptors in the prefrontal cortex is important for sort of regulating the amount of attention a person has. Alpha-1 receptors, remember those two receptors have opposing effects on adenylate, right? So it makes sense that they would have opposing effects on, excuse me, the psychological processes that they sort of underlie. So working memory in terms of norepinephrine sort of has this inverted U shape, right? So at the one end, if you don't have enough norepinephrine, you get effects like sedation, so that's sleepiness, which again, that kind of makes sense, and it harkens back to the previous slide. You have activation of the noradrenergic system and you get wakefulness. So not enough norepinephrine, you get sedation. When you have sedation, it's hard to pay attention, right? Like if you're super sleepy, it's hard to pay attention to things that you need to pay attention to. And then you get this sweet spot where you're somewhere in between sedation and like hyperarousal, and that's when your working memory and attention are where it should be. But then you get too much activation of the noradrenergic system, and then you start feeling really stressed. Okay, so we don't want that either. And then it's also very hard to pay attention while you're having this like stressful period. So you really want to get in the sweet spot of norepinephrine. And a lot of drugs that modulate the noradrenergic system kind of help balance that. This is a little bit beyond the scope of this particular video, but you're probably thinking about ADHD because I think that's the logical jump here. We're not going to talk about ADHD drugs in this module. We will come to it down the road. Actually, we'll talk about it briefly in this module, but down the road because we'll talk about amphetamine. But what a lot of these drugs do is they help balance the amount of norepinephrine and dopamine in the brain, not like increase one and not increase the other, because it turns out that arousal and attention is you need to have a nice balance of these different transmitter systems. Okay. Norepinephrine is also really important for memory consolidation, particularly emotional memories. So that's true for norepinephrine and epinephrine. Y'all have heard of flashbulb memories, right? So, okay, here we've got a good one here. An emotional memory, people tend to remember exactly where they were at the time that that memory was formed. Classic examples are like, where were you when you found out that 9/11 had happened? That's really old now. I was in college. I remember the exact moment that I found out about, what was happening to the World Trade Centers. Of course I did. I was 18 or 19 or something like that. Y'all don't remember that, of course. So something a little bit more current. What about the pandemic? Where were you when you found out that COVID-19 was declared a pandemic? That was just 6 months ago. So you should remember that. Okay. And this is showing you something that you should be pretty familiar with. So this is a version of place conditioning. So you're lucky I'm going to actually explain place conditioning here. So the group that did it, which by the way, you did a great job, but it'll be in the video too. So here what you're doing is you're training this animal for an emotional memory. And in this example, we're not using drugs, but we're using an aversive stimulus. So that would be a foot shock, right? So here, well, let me back up for a second. Rodents, since they're prey animals, they want to hide in places where they feel like no one's going to come and eat them, right? So when you are presented with a compartment like what you see in figure A here, the animal can be in the light compartment or they can be in the dark compartment, and they can choose which compartment they want to spend their time in. Rodents are more often going to try to choose to be in the dark compartment because that's where they feel safe, okay? So this is a good measure of a lot of different things. You can measure anxiety-like behavior in rodents because rodents are also pretty curious, so they want to come check out the light compartment, but ultimately they're most likely going to spend most of their time in the dark compartment. But what happens if you pair a negative emotion with the dark compartment, like a foot shock? Nobody likes a foot shock, right? Rats don't like foot shocks either. So what that's going to do is they're going to have this association between the dark compartments, that would be the conditioned stimulus here, and the foot shock, that would be the unconditioned stimulus. And what that foot shock does, that's a negative emotional memory. And that activates the noradrenergic and adrenergic system. And if you block those systems during formation of a memory, it actually impairs formation of that memory. And that becomes important because there's some drugs, beta blockers, which I'll talk about on the next slide. So you can never say this word, it has too many R's. Propranolol is a noradrenergic beta receptor blocker. And it's used largely for blood pressure, but now it's also used for a lot of anti-anxiety things as well. There's a lot of research that shows that cognitive behavioral therapy paired with dosing of propranolol can help remove negative memories, like for someone who is a victim of post-traumatic stress disorder or something like that. So if this person has survived this really awful traumatic event, they go through the cognitive behavioral therapy, so that will help them kind of rework the conditioned stimuli, right, that they have associated with that memory. So in this example, it would be the dark compartment. This is a scary memory for this rat. So you're going to rework the conditioned stimuli so that they no longer elicit that fear response. But then you're also taking a drug, right? Propranolol, it's going to block the noradrenergic system. It does a few other things on the molecular level that are beyond the scope of this video. But what that does is it helps the person relive that memory in the absence of the emotional trauma and the emotional, sympathetic nervous system activation. And then that helps them process that memory and lose the trauma. And there's a lot of really good data about that, which is pretty cool. So why else would we use noradrenergic drugs? Well, I talked about at the very beginning of this video that norepinephrine is really important in the peripheral nervous system as well as the central nervous system. So there's a lot of peripheral effects that are related to blocking or activating the noradrenergic system. So for example, you can use alpha and beta agonists to treat asthma. Albuterol is a really common drug, and that's a beta-2 agonist. So that's really commonly used for asthmatics. Probably some of you might take that. I've certainly had albuterol before. Alpha-1 agonists are common decongestants. So activating different parts of the peripheral nervous system are going to cause secretions and things like that. So if you're congested, you might take an alpha-1 agonist. We've already talked about the alpha-2 agonist clonidine. Remember, alpha-2 is also that autoreceptor. So we talked about clonidine. When did we talk about clonidine? Why don't you pause that for a second and just reactivate that memory? I'm not going to tell you. You can go back to the previous video and watch it, but we have an opportunity here, right? So what is clonidine? It's an alpha-2 agonist. What does that do with the autoreceptor? How does that impact noradrenergic neuron firing? And what was the example that we used with it? Pause, answer that question, and then come back. Okay, so agonists like this can cause sedative and anxiolytic side effects, just depending on the dosing, but that also makes them great anxiolytic drugs. An anxiolytic drug is a drug that someone would take as an anti-anxiety drug. Something that's anxiolytic is going to block anxiety. Something that's anxiogenic is going to increase anxiety, okay, just so you know. And then here's propranolol, which I already talked about on the previous slide. That's a beta antagonist. So they're commonly referred to as beta blockers, right? So those are common blood pressure medications and anti-anxiety drugs. Okay, so make sure you know these, know the drugs that are on the slide, okay? And all right, let me know if you have any questions, and have a wonderful day. Bye-bye.